So with that, what I'd like to do is introduce our two presenters for today. So we have Rachel Frederickson, who is a PA here at Vanguard. She works out of our Briargate office. She got her PA degree from Midwestern University. She has been in dermatology for well over a decade, and she takes care of a full range of medical dermatology conditions. And then we have Megan Stimpson, who's also a PA here at Vanguard. She works out of 3 offices, so she's a busy lady. She is in Briargate, Broadmoor, and Pueblo. She got her PA degree from the Medical University of South Carolina, and she has also been in dermatology for a decade, and so has just a wealth of experience across the full range of medical dermatology. Both of these women, in addition to just being lovely people to work with, they have some similarities. They are both the mother of 2. They are also both experts in allergic contact dermatitis. They do patch testing at Vanguard, and so all of our other medical providers refer allergic contact dermatitis patients to Rachel and to Megan. And they are also both part of what we call our Vanguard Haiti team. And so they were on our last team that went to Haiti and served in a project there. And so I'm just excited to have both of them presenting today, and I think you'll enjoy this session and learn a lot. And so with that, I will hand things over to Rachel and Megan.
Thank you, Lisa. We appreciate it. Well, good afternoon. We are so excited to be able to discuss this topic with you today. As Lisa had mentioned before, Megan and I specialize in contact dermatitis and rashes in general, and we love being able to see the positive impact that we can make in our patients' lives who struggle with dermatitis on a daily basis. So we designed this talk to be very practical. At first, we're going to talk about hand dermatitis, the different types, and how to treat. Then we're going to talk more about things that you can even do today to improve your hand dermatitis. At the very end, we'll talk about products to use, what products not to use, and then we'll also have a time for questions at the end. So let's get things started. I would love you to raise your hand if you or a family member have developed hand dermatitis from all the hand washing and sanitizing that you've been doing over the last 6 weeks. So I have a confession to make. I am right there with you. I have caused my own hand dermatitis because I haven't followed the recommendations that I give to my patients. But the good news is we can reverse that. There's definitely steps that you can take, that I can take, to improve our skin barrier and to heal hand dermatitis as well. So, great. So we all know that regular hand washing is a really important way to prevent from contracting and spreading disease. And there is a reason why the CDC recommends actually 20 seconds of hand washing multiple times a day. In this study, they found that people who washed their hands for only 5 to 10 seconds were much more likely to get the flu than those who washed their hands for 15 seconds or more. And also, soap is recommended, and that's because soap helps to break up the fatty outside layer of viruses and bacteria. And then viruses and bacteria, they break apart. The surfactants in the soap kind of gather up all the viruses and bacteria, and then the water rinses everything off. So the problem is a lot of soaps are very basic or alkaline, and so they strip the skin of natural oils, leaving your skin dry and cracked. So a few tips that can help you with hand washing. Number 1, use warm water and not hot water. Hot water does not give you any benefit, and it just dries out your skin more. Avoid scrubbing your skin because it can cause cracks and little cuts in your skin. And also avoid using antibacterial soap because it's actually not necessary when fighting infection. We find that non-soap cleansers can work just as well. Sorry, here we go. And then the CDC also recommends hand sanitizers that have 60 to 95% alcohol to inactivate COVID-19. And that what the alcohol does is it denatures proteins and it breaks apart, again, the viruses and bacteria and inactivates them. We recommend ethanol-based hand sanitizers if you can find them because they are better tolerated and they are less drying typically. And if you find a hand sanitizer with humectants like aloe vera or glycerin in the ingredients, those can be a lot more moisturizing to the skin. So humectants are ingredients that, when put on the skin, basically help to gather moisture in the air surrounding your skin and bring it into your skin. So you will feel more moisturized if you find a hand sanitizer that has one of those two humectants in it. So let's talk about irritant contact dermatitis, because that's probably what a lot of you have been experiencing lately, just like myself. Irritant contact dermatitis, we also call it ICD. It shows up like red, dry, cracked skin on the hands. It's most common on the backs of the hands and then also in between the fingers. And irritant contact dermatitis is a rash that is not caused by allergy, but rather it's an irritation or a breakdown of the skin due to substances that cause that on the skin. People get sensitive skin, they get burning, and if it becomes chronic, itching often sets in as well. So we can see this in little toddlers, we can see this in their great-grandparents, everyone can experience this. My boys, when they wash their hands a lot at school and come home and do the same thing, and they don't put moisturizer on, they look like really dry, chapped hands on the back. Even like when you make a fist, it can crack and hurt and be really red and burn. And it's interesting because ICD can happen even within a few hours of exposure. And especially if the exposure was repeated, then it can get worse and worse and build on itself. So some common irritants that we see can be soaps, detergents, and bleach. And for people who use a lot of household cleaners and dish soap without wearing protective gloves, they may find that they struggle a lot with irritant contact dermatitis. Now, what's interesting also is that a lot of our patients are surprised to find that water itself, just plain water, is an irritant. And that's because of the wet-dry cycle. So when we have our hands in water and then we're back to dry and then water and dry again over and over and over, that leaves our skin just devoid of natural oils and dry and cracked. So it's a surprise that water by itself can do that. So allergic contact dermatitis, which we call ACD, and irritant contact dermatitis can really look very similar. And especially the longer they've been occurring on the skin, the more similar that they look, the harder it is to differentiate the two. But the hallmark of allergic contact dermatitis is itching. So sometimes the itching can be really severe as well. So you get red, dry, cracked rash. We see blisters as well associated with ACD. And allergic contact dermatitis occurs when your immune system in your skin decides to not like a substance or a chemical. And then every time that substance touches your skin, you can develop allergic rash in that area, but sometimes that allergic rash can also become more widespread. So the tricky aspect about ACD is that it often occurs like 2 to 3 days after exposure to the substance that you had an allergy to. So it can be really hard to know, okay, what was touching my skin 2 to 3 days ago that developed this rash today? So, and there is a myth about allergic contact dermatitis that you can only have an allergic reaction to a new product. So we have a lot of patients who say, well, I haven't used any new products, so therefore my rash could not be caused by an allergy. But what we actually see is our patients will come in, they've used products sometimes for decades without any change, to use the same things, but it's their immune system that changes and decides to target a chemical in their products. It's something called sensitization, where their immune system sensitizes it, targets a certain chemical, and then every time it sees that chemical, it will cause rash. So if we suspect that our patients may have irritant or allergic contact dermatitis, we may recommend a special type of allergy test called a patch test. So with a patch test, we load individual allergens into these panels, as you can see on the left side of your screen. We put these panels on the back and leave them on for 2 days. Our patients then will take them off at home, and then 2 days later, we'll read the skin and we'll see if they have any reaction. So the reactions will look very much like the spots on the right side of your screen, where they develop a little rash in the area where the chemical was touching. So it's important to note, though, that this allergy test does not test for food allergies or pollen or dust mites or dog dander. Instead, it is a test for chemicals in your products. So things like preservatives, botanicals, fragrances, dyes, metals, those are the things that we test for with patch testing. So treatment, let's talk about treatment. Treatment for allergic and irritant contact dermatitis often involves using topical steroids or topical non-steroid creams or ointments. And what we choose really depends on the location of where your rash is and how severe it is. But the key to clearing ICD and ACD really is to avoid the substance that's causing the allergy or the irritant in the first place.
All right, so moving on to a different type of eczema, dyshydrotic eczema is often known as wet eczema or Pamphilox, but this is a type of eczema that is usually localized to the palmar surfaces of your hand or fingers, and also the lateral aspects of your fingers. This can also occur on the feet, which is why there's a nice photo of a plantar surface there on the bottom of a foot, but this does not tend to affect other areas of the body. It is hallmark characteristics are going to be these deep-seated or tapioca-like vesicles under the skin or blisters. And when they surface, they can cause some scaling, and that process can be both itchy as well as patients will often complain of stinging or burning, particularly in the early phase when they start to feel those vesicles form. But after those vesicles surface, it can cause, again, some scaling, some breaking of the skin, and some itching with that. This form of eczema can be precipitated by a variety of factors. Stress can actually induce a flare in dyshydrotic eczema. And then for some people, they are sensitive to different things they may come in contact with, whether that's heat, sweat, water, soap, other mild allergens or irritants can also cause flares. But this can flare without a specific contact inciting this. All right, so managing dyshydrotic eczema is very similar to how we manage allergic and irritant contact dermatoses. So a potent topical steroid, which would be prescribed by a provider. This is not the time to try to control it with over-the-counter hydrocortisone. This tends to be a highly inflammatory process that usually takes more aggressive topical treatment. That being said, we often do not need to rely on oral medications. So a potent topical steroid is very helpful. And then help preventing further breakdown of the epidermis and protecting the skin, especially when it's in that inflamed state. So wearing kitchen gloves, as seen in this photo, when doing dishes, housework, or yard work outside, moisturizing with a bland hypoallergenic cream that can help repair and restore the natural skin oils and fatty acids, and we'll talk a little bit more about that later. Great, so frictional dermatitis is yet another form of hand dermatitis that is sometimes misunderstood or misidentified in patients and even providers. This form of dermatitis is sometimes called wear and tear dermatitis. It can affect other parts of the body, but especially hands, fingertips, the ends of your fingers here, what we would call the distal fingertips. It is generally from a chronic and cumulative exposure, and this is more mechanical in nature. So think pressure, think friction, think rubbing. So if you're constantly touching, rubbing, moving a substance that can irritate the skin, especially if it is a porous object that can pull or wick moisture out of the skin, you're going to be more likely to develop frictional dermatitis. This is not as much an acute process. So this does not happen overnight. This happens after weeks or months of similar exposure or repetitive behavior. So as you can see here in those pictures of those fingertips, especially that bottom photo of the fingertips on those middle two fingers, you can almost see like a loss of the fingerprint. That's a hallmark sign. Lots of peeling skin that looks thin, fragile, tears, cracks easily. These folks are pretty, you know, it's debilitating. It really affects your quality of a life, especially on those finger pads that you're using and depending on throughout the day for normal activity. When they start breaking down and cracking and become sensitive to everything, that's pretty miserable. However, even though this form of dermatitis does have an inflammatory component from that friction or mechanical wear and tear on the skin, we treat it a little bit differently than how we've mentioned allergic, irritant, and dyshidrotic dermatitis being treated. We'll get to treatment in just a second, but going back to some of the common culprits, these are just visuals in different sources of the frictional or mechanical dermatitis. So you can see a brace. This can occur anywhere on the body, but in terms of hands, creating pressure points around the thumb or the back side of the hand where the brace wears, you can get a little dermatitis or sometimes thickening of the skin, and sometimes that skin will also darken just from the pressure of that brace on that same point of contact in the skin over time. On the top part of the screen, you can see some fingers rummaging through a big pile of paper. That's probably one of the most common sources of this frictional dermatitis, is handling a lot of paper. So people who do office work, sometimes people who come in contact with a lot of cardboard, postal workers, paper is very porous and it has the dual action of wicking moisture out of your skin as you touch it, and then also that frictional component of moving back and forth across your skin. And that can lead to some pretty prominent frictional dermatitis. So paper is a big offender. In another photo, you can see some women performing yoga. Again, anything that people do habitually several times a week is enough to put pressure on different points of your hands, or if they're have their knuckles down on those knuckle pads, and that can cause some dermatitis to the backs of the hands. Knitting or working with yarn or cloth, crocheting, again, those fabrics are going to be very drying to the skin as you constantly touch those and pull moisture out of your skin, as well as the frictional or mechanical component holding the yarn and manipulating that around your digits. And then last but certainly not least, folks who work with their hands. So mechanics, outdoor laborers, contractors, construction workers, again, using tools, especially if there are solvents, metals, rubbers, dyes, you get kind of a combination of contact dermatitis with your frictional dermatitis, and that can be very irritating to the hands, especially because most of these people, that's their profession, and so they're doing it for hours on end, days at a time, for months and years, and that can cause a lot of chronic dermatitis, frictional dermatitis for these folks. So moving on, I alluded earlier to the, how we treat this form of dermatitis a little bit differently than allergic and irritant contact dermatitis. I will preface to say that if there are some allergens involved or a lot of itching, or you suspect an underlying allergy, you could certainly start with a steroid to calm down some of that inflammation. But ultimately, when we're dealing with a thickening of the skin or hyperkeratotic skin, almost the way your skin calluses in an inflammatory way over time, we want to use creams and lotions, sometimes gels, although those are more drying to the skin, that can help break down that skin in a healthy way or exfoliate that excess skin. So Tazorac on the left-hand side of the screen in the gray and white, that is going to be by prescription. That would be sometimes used for really hyperkeratotic or thickened areas of the skin. That's in the Retin-A family. So that certainly promotes exfoliation, but it is very, it's more aggressive. It would be prescribed by a provider and monitored carefully. Now, these other three that are shown on the screen are all over-the-counter options, and they are more in the family of alpha hydroxy acids, which help promote healthy exfoliation. But these are also moisturizers that have other ingredients that can help moisturize your skin as it exfoliates and decreases that thickening of the skin. So amlactin uses lactic acid. Urea, right here in the middle, that's available on Amazon. Urea is an excellent exfoliant. And then all the way on the right, one of my personal favorites, CeraVe SA Soothing Cream. The SA is for salicylic acid. CeraVe has other excellent products, but specifically their SA cream is going to help with exfoliation. All right, last but not least, in the world of hand dermatitis, sometimes patients can develop psoriasis over time, and it can go unrecognized or mistaken for a simple hand dermatitis. Psoriasis is actually an autoimmune disorder, so there's a strong genetic component. When it localizes or is mostly involved to a focal area like the palms, that is strongly correlated with a history of tobacco use. So it can present very similarly to some of the other types of hand dermatitis that you've seen. So some redness, some scaling, some breaking of the skin. It's often itchy, it often burns, it often stings. And again, it can be profoundly debilitating in everyday life, both for employment as well as activities and hobbies. So we see a good bit of hand psoriasis. So let's talk a little bit about the management. So hand psoriasis does tend to be pretty recalcitrant or difficult to treat. It is very, very important to stop tobacco use. I'd say if at all possible. Of course, that's a personal decision, but it can really help diminish some of the severity of your hand psoriasis. So all of these things that you see here would be prescribed and monitored by a provider. Humira is a biologic medicine that's an injectable that works more specifically on targeted proteins in the immune system. Otezla at the bottom here is a pill that you take. It does not suppress the immune system. It has a unique system or mechanism of action. but some folks feel that Otezla is one of the more beneficial medications for specific hand psoriasis, as opposed to generalized plaque psoriasis, where you get in other parts of the body. At the top, you'll see the mainstay of focal psoriasis or localized psoriasis treatment, calcipotriene and betamethasone. That is a combination ointment that has a vitamin D analog with a strong topical steroid, and that is very helpful. And then in the middle there is Taclonex, which is just a branded version. It's been around a long time, but very helpful in treating psoriasis. All right. And then before we wrap up on the types of hand psoriasis, just a note about nails. So these two photos both have different characteristics of nail dystrophy, or nails that have been injured, don't have a characteristic appearance of a normal healthy nail. So let's talk a little bit about that. On the left-hand side, you can see there, the index finger or pointer finger, you see some horizontal ridges in the nail. And if you look closely at the skin around the nail, particularly on the lateral nail folds, the skin looks a little puffy and red, and it almost looks like it's separated away from the nail. So this is what we call paronychia. This is most likely a more chronic paronychia. I don't see signs of an acute infectious process. But chronic hand dermatitis can cause chronic inflammation around the nail. And over time, that puts pressure on the nail matrix, which is the little factory that makes the nail, and can result in nail dystrophy. So a common question I get is this permanent? Am I always going to have these lines or ridges on my nail? To which I answer, hard to say. It depends on how much damage and for what period of time that nail matrix or nail factory has been affected. If it's only been going on a few weeks, then sometimes we can treat the surrounding hand dermatitis and the nail can grow back normally. But if this has been going on for years or years, sometimes those nail changes or that nail dystrophy is permanent. And then on the other side of the screen, you can see numerous nails affected. And this looks different than the nails that we see on the left-hand side of the screen. The nails on the right-hand side of the screen, you can see some yellowing under the nail to the distal edge of the nail, or the nail furthest away from the cuticle. And then you see all these little divots in the nail. So what does that mean? So the yellowing of the nail is, we call them oil spots, but it is a sign of psoriatic nails. So with psoriasis, your nails can also be affected. So some of that yellowing of the nail, sometimes it's mistaken for nail fungus, but it's not. Those are actually psoriatic nails. And then you can also see all those little divots. We call them pits or nail pitting. But again, that's another hallmark sign of psoriatic nails.
Mm-hmm. Great, thanks, Megan. Now we're going to go to the part in our talk where we're going to discuss some products to use and some products to not use, and some overall recommendations for you. So when it comes to cleansers, for those with hand dermatitis, we recommend cleansers that are soap-free and also relatively allergen-free. So CeraVe makes some really nice cleansers. They have the hydrating facial cleanser, which comes in a pump, and then the hydrating cleanser bar. Both of these are really nice options. Vanicream has a gentle facial cleanser and a free and clear liquid cleanser. All of these are great. You can buy them online. You can get them at any store that has a pharmacy. If you cannot find them on the shelf, you can always ask a pharmacist, because sometimes they have these products behind the counter, even though they are not prescription. And as far as moisturizers, moisturizers are the key to helping heal your hand dermatitis and improving your skin barrier. So today, without even making a trip to the store, you can start by adding more moisture to your skin. And we'll start with Vaseline, just plain Vaseline. It is allergen free, and most of us have a tub of it somewhere in our bathroom cabinet. So Vaseline is known as an emollient. What that is, it creates basically a oily layer on the surface of the skin, and it traps moisture into the skin. So after washing your hands, your skin absorbs water, a little bit like a sponge absorbs water. And then right away, if you can put Vaseline on your skin, it locks some moisture in. So it can really give your skin a lot of softness and flexibility if you use something like Vaseline on a regular basis. We'll also talk about Neutrogena Norwegian Formula hand cream, now specifically the fragrance-free version. This product is a great hand cream. It's very thick. It has emollients, which again lock in the moisture, and then it also has humectants in it, which again, humectants on the skin, they bring moisture from the air into your skin. So we're locking in the moisture, we're bringing in extra moisture as well. It's a really nice product to use multiple times a day, and especially before bed is a great time to use it to have really nice soft hands in the morning. There's also Baby Ganix Soothing Protective Ointment. So this product has a lot of different botanical oils in it. It has jojoba oil, sunflower oil, a flower extract called calendula, which is known for its anti-inflammatory properties, and it helps to heal eczema naturally. So if you're looking for a product that's a little bit more natural, this is a good one. And then one of my favorite moisturizers is called CeraVe Healing Ointment. So CeraVe Healing Ointment is unique because it has ceramides in it. Ceramides, they basically help the skin make its own natural oils. So instead of just being a moisturizer that locks in moisture, it's a moisturizer. The ceramides help the skin repair itself. So I would say it's a little bit more high tech than your average moisturizer. And all of these products you should be able to easily find at any store. With a pharmacy, you can also order them online. Baby Ganix is also typically in the baby aisle at any store. So let's talk for a moment about what not to use on your hands. I think this is just as important because sometimes Megan and I have patients who come in who use some of the products that you're seeing in front of you. And unfortunately, they think that it's helping their hand dermatitis, but in the end, it could actually set them back. It can actually cause more dryness, more irritation. So I'll start with a Dial antibacterial. Like I had mentioned before, antibacterial soaps are really not necessary. An antibacterial soap will not help at all against the coronavirus. And there is a concern that antibacterial soaps, if they are overused, could cause antibiotic resistance. So in general, plain soap, non-soap cleansers, those are fine to use, but we don't recommend having one with an antibacterial component. It's just not necessary. And then there's 70% isopropyl alcohol. So isopropyl alcohol by itself is not the best product to use directly on the skin. It will certainly keep your skin very clean, but the problem is it will turn small cuts into larger cuts. It will dry out the skin. It'll make the skin crack. It'll just strip the skin of natural oils. So there certainly is isopropyl alcohol in many different types of hand sanitizers, but those hand sanitizers also have those humectants or those moisturizers included. So it's very, very different if you're just using pure isopropyl alcohol on your skin. So I'll have Megan talk about the other options of what not to use on your skin.
All right, thank you. So with apple cider vinegar there in the corner of the screen, apple cider vinegar is a very popular cure-all remedy of our time. It certainly has uncontested health benefits for other conditions or disorders. However, we do not want to be pouring it or applying it directly on our skin. especially when our skin is already cracked, dry, broken down. It's going to act like an astringent and further dry and crack your hands. If you're looking for more natural antimicrobial or anti-inflammatory properties that is touted in apple cider vinegar, there are certainly more healthful and helpful alternatives. Again, something like the Baby Ganix Soothing Protectant Ointment with the calendula. You can certainly have some more natural options without necessarily resorting to apple cider vinegar. So let's not use that one on our hands. Hydrogen peroxide is a very potent oxidizer and can actually be really corrosive to the skin. Again, especially when used to already damaged, compromised skin. So not to say that it doesn't have a place in skin care when used diluted or for small cuts or wounds if you want. But generally speaking, that's not something we want to be dousing our hands with. Dish detergent. So Dawn has these wonderful commercials about how gentle it is for even ducks and cleaning up oil spills and that kind of thing. But remember that the goal of detergent or dish soap is to cut through oils and greases to get our plates nice and clean. What we don't realize is that it's also cutting through those natural oils on our hands and stripping our skin of the natural oils and fatty acids that help heal, protect, and moisturize our skin. So even though it may be great for helping clean up oil spills or other things and very, very gentle for animals, it is not going to be very helpful in contact with our skin. So we want to make sure we're protecting our skin with kitchen gloves when we're using dish detergent. All right, so what should you use on your hands? So rubber gloves, nitrile gloves, vinyl gloves. So there's so many different options of gloves. So even if you have like an allergy to latex or nitrile, there are other options out there. Vinyl is a great alternative. So generally we think about using rubber, nitrile, or vinyl gloves to help keep water out or solvents out if we're doing work in the kitchen, work in the house, work in the yard, gardening. That's more to protect our skin from the outside world. And then these bottom two, so cotton jersey gardening gloves or white cotton gloves, that really helps keep moisture and oil in our skin. So those are going to be used more throughout the day if we're not doing heavy work or at nighttime, like Rachel mentioned. We can put on our Neutrogena Norwegian hand formula cream or a thick moisturizing cream like the CeraVe or their healing ointment, and then sleep with those gloves on our hands. And those are really going to help lock that moisture and those ceramides into our skin to help repair our skin as we're sleeping. All right, so especially in these times when everyone is even more cost conscious than usual, we're all on really tight budgets. So we mentioned that CeraVe is kind of a high-tech brand. Well, what can be readily available to all of us? So our dollar store hand dermatitis kit, and there is nothing wrong with any of these products. I have all three in my house right now. So Dove Sensitive Skin Unscented Bar Soap is a great cleanser for our skin, and that's available at your dollar store, but just for bathing. That's going to be very gentle and mild on your skin and very helpful when you're prone to dry skin disorders. These reusable kitchen gloves, again, a must-have for anyone looking to protect their hands, whether to help heal from chronic hand dermatitis or help prevent hand dermatitis as we're washing our hands frequently throughout the day. kitchen gloves are very basic, easy to use, not expensive, and they make a world of difference in the outcome of our skin health of our hands. Petroleum jelly, as Rachel already mentioned, it's a large particle. It's not absorbed in your skin, so we're not worried about deleterious health effects to our skin. But it's a great moisturizer, just sits on the surface of the skin, and is readily available and very cost effective as well. All right. So right now at Vanguard, we are offering virtual visits to help accommodate all of our patients that we can and help keep our vulnerable patients healthy and protected. We are accepting new and established patients. Many insurances are approving these visits. We do use a HIPAA compliant platform, and we have audio and video availability to assess, diagnose, and come up with a treatment plan for your conditions. Some specific things that we're seeing through our virtual platform right now: acne, rashes, concerning lesions, refilling standard medications in the dermatology field, and more. We are also offering free Friday telederm visits in April as a thank you and awareness to those who have made sacrifices or who have been jeopardized by some of the financial implications of COVID-19. So we'd be more than happy to talk to you and assess some of your concerns. Please call our office. Our team would be really happy to help out and schedule an appointment.
Great.
Great. Well, thank you, Megan and Rachel. So that was really helpful information. And at this time, if anyone has questions, feel free to click on the bottom there where it says Q&A. So just click on Q&A. Feel free to type in a question and for either Rachel or Megan, and we'd be happy to answer it. So I'll give it a moment here. All right, so if there are no questions, I actually do have one that I'll pose to both of you. So you talked just very briefly about patch testing. Can you tell us when you typically recommend patch testing and exactly what that process is?
Sure, I'll talk about when we might decide to consider patch testing, and Megan, if you could talk more about the specifics of how patch testing works, that would be great. So with patch testing, we consider recommending a patch test for a patient if they have dermatitis that is new, that they've never had before. Or we see a lot of patients who have had eczema for years, or they had it when they were young and they didn't have it for a while and all of a sudden it's back again. So if we have like a worsening dermatitis, they've never had it before, we don't know why they have it, it's persistent, we try to treat it, even with treatment the rash keeps coming back, that's a point where we may consider, could there be an allergy that's leading to this? There's also a lot of patients that we see who will say, well, gosh, you know, it's something in my cosmetics. I know that whenever I try to buy some eyeshadow and put it on, I get rashes on my eyelids and I can't find an eyeshadow that works. Or every time I dye my hair, I get itchy and I get rashes on my ears. So those are some scenarios where we see where a patient may say, you know, I think I might have an allergy. So it's in those instances where, you know, we just have a dermatitis, it's not improving with typical treatment, it keeps coming back, and we want to see if we can get down to the bottom, get an answer as to why this rash keeps happening. That's when allergic patch testing, allergy patch testing is most helpful.
Great.
Yeah. And we can certainly talk more in person, but patch testing is a process that occurs over several days. It's not all done in one day, the way allergy testing would be performed by an allergist. So you would come in one day, have patches placed, usually on your back. Those patches are removed at home 2 days later. 2 days after that, you come back to the office and we examine your skin for those pertinent changes to the allergens that we've applied.
Okay, great. And then we do have a question coming in from a participant. It says, can you see psoriasis on toenails as well?
Yes, absolutely. Yes, great question.
And then there's a question, what do vertical ridges in the fingernails indicate?
Great, so there's not one answer. We would need to take a look, but probably the most common presentation is going to be nail trauma. We have like a longitudinal ridging or a median nail dystrophy, and that's usually from trauma to the male matrix. Sometimes that's from a tick, like if you sit there and pick the cuticle at the base of your thumb, over time you can develop this longitudinal ridge in the middle of your thumbnail. That can happen to any nails for a number of reasons, but that's one of the most common things that we see.
Okay, all right, great. Well, I know that we're just a couple minutes over on time, so I just want to close out, thank all the participants for joining us today. We did record this webinar, and so we will have that available for folks to view. And then Rachel and Megan, thank you so much for making time and sharing with all of us.
Thank you all for being here.
Thank you so much. It's been a pleasure, Lisa.
Bye.